For better or worse, Kenny Rogers has now turned into Dolly Parton. Kenny Rogers had that warm, masculine, approachable presence that made him a country music legend. He was well known for his friendship with Dolly Parton, and while I know next to nothing about country music, if you take a look at this photo of them together juxtaposed, it kind of recreates the features of masculine and feminine eyelids to a T. In young Kenny Rogers' case, we have that naturally set, low crease on the upper eyelid, which again is that area where the skin starts to fold over. If you tip your chin back and you look underneath your hooded eyelid skin, you'll see a natural crease point. In men, that tends to be lower than in women. The second thing you see is that his brows are sort of low set. They're pretty close to his eyelashes. There's not a lot of distance that you can see between them. While there's a lot of variability to male and female anatomy, in general, men tend to have lower set, flatter eyebrows, like you see in this photo. Lastly, he has an even canthal tilt, which is the corner of the eyelid where the upper and the lower eyelids meet. It goes straight across. Remember that for later. In contrast, let's take a look at Dolly right next to him. Right off the bat, you can see she has a high eyelid crease. You can see her eyelid crease because there's not skin overfolding that area, and it's much higher up. Women tend to have an eyelid crease in the 1 centimeter range. Men, it's more like 7-8 millimeters, so a little bit less. And even though that doesn't sound like a very big difference, the difference between your eyelid crease being high and more normal is the difference between imperceptible and botched plastic surgery. Next thing is Dolly has more of an arch to her brows. They sit really high on the brow bone over here. That's a more classically female feature. And the third thing is that canthal tilt, the corner of the eyelid, is pulled upwards a little bit, and that is a more feminine feature in general. Now, what happens if a surgeon uses techniques that are going to feminize the eyelids when they're operating on a man? This happens. Kenny unfortunately had one or several eyelid surgeries that made him look kind of perpetually shocked and took away some of that warmth to his appearance that he was associated with before. Here are the 3 things that went wrong from a surgical perspective. The combination of these 3 things is what made Kenny have a more feminized appearance after his surgery. Similar things may have happened with other prominent male celebrities. So when surgeons use techniques that are typically used for female eyelid surgery on a male, if you get a high eyelid crease or an arched brow or a positive canthal tilt, that can be associated with a more feminine or unnatural appearance. There are 3 keys you need to understand if you want to have a successful outcome. There are a lot of confusing terms we use, but I'm going to simplify male eyelid surgery so that you don't turn into Kenny Rogers. And as a bonus tip, if you stay until the end of the video, I'm going to talk about surgery to fix bags under the eyes for men specifically. I'm Dr. Kian Eftekhari, and I am a board-certified eye surgeon specializing in eyelid surgery. Here's what most people don't realize. The anatomy of the eyelids in men and women is fundamentally different. So what are the 3 features that men have? Men have, number 1, a naturally occurring lower eyelid crease. So the eyelid crease is that area in your upper eyelid where the skin begins to fold over into a fold. If you tip your chin back, you can kind of see the outline of it. And in men, it's lower than in women. Number 2, men tend to have naturally low-set brows where the distance from the eyebrows to the eyelashes is smaller than in women where it can be more widely spread. And number 3, men usually have an even angle to the outer corner of the eyelid. We call that canthal tilt. In men, it's usually even, maybe even sometimes downwards, but never overly upwards. In contrast, women tend to have a higher eyelid crease where you can kind of see the span of the eyelid. Second thing is women tend to have more of an arch in the eyebrow or a higher set eyebrow that goes higher on the bone, not sitting along the brow bone or even below it like a lot of men do. And third, women tend to have a more upward tilt to the outer corner of the eyelids. Sometimes I try to recreate that in surgery, but you don't want to do that in a man. And gentlemen, once it's done, it's hard to reverse. So what should male eyelid surgery look like? Let me tell you 5 things that are super important. Number 1, conservative skin removal. You should not remove too much skin in a male upper eyelid because it's going to take away some of that overhang appearance and that hooding. If you completely take away or obliterate the hooding, it's going to make somebody look a little bit more hollowed out. I typically remove less skin on male patients than on my female patients because I'm trying to avoid that hollowed out look. I call this more of a preservation technique where I'm trying to preserve the natural features of someone's youth without necessarily obliterating it. Number 2, lower eyelid crease position. So we talked about the upper eyelid crease. In men, you have to keep that around 8 to 9 millimeters. You don't want to go 10, 12, or even 15, which I sometimes see, because that is what's going to give you that high crease, hollowed out, more feminine appearance to the eyelid. Number 3, respect the brow position. For most men, you want to have the brows kind of going straight across on the bone, not artificially arched or lifted out in the corner. For most men, the type of brow lift they need is more of a sideways or lateral pull as opposed to a more vertical lift where the center and the arch of the eyebrow are going up. Number 4, maintain the canthal tilt. In a lot of men, the outer corner of the eyelid does need to be operated on because we develop laxity in that area really easily as life goes on. However, you don't want to overly aggressively lift that to where the angle of it is going upwards. You want it to be straight across, maybe a touch upwards, but not overly so. And number 5, fat preservation. You don't want to remove too much eyelid fat during surgery because that's going to give a more hollowed out appearance. It's okay to have a little bit of fullness in the upper eyelids. For better or worse, that is what kind of makes a more male appearance rather than a more feminized appearance of the upper eyelids. The goal is simple. You should look more awake, refreshed, and kind of a better version of yourself. You're not trying to look like a different person in most cases. Your friends should be thinking, oh, he must be getting a lot of sleep, or maybe he's lost some weight, and not, oh, who did his eyelid surgery? If you're considering eyelid surgery for men, here are the things you want to look for in your surgeon. Number 1, board certification is important. I'm a board-certified eye surgeon specializing in oculofacial surgery. There are other board certifications of types of surgeons that do eyelid surgery, like facial plastic surgery and comprehensive plastic surgery. But you just want to make sure you go to somebody that does a lot of eyelids and not somebody that's mainly doing noses or mainly doing breasts and body, which those other specialties do a lot of. Number 2, a good portfolio of male surgeries with the type of results that you're looking for with your surgery. And number 3, and this is subtle, you want to go to a surgeon that understands canthal tilt. Go to their before and after page. If you see a bunch of male patients where the corner of the eyelid is artificially kind of pulled up like this, then they may not be applying those techniques that I'm talking about in terms of how to approach men versus women as distinct types of eyelid surgery. And then here are 3 red flags. If the surgeon is promising a dramatic result or a much younger version of yourself, you might want to think about whether that's going to give you that natural and well-rested appearance as opposed to whether it's going to give you more of a obviously had surgery type of appearance. Number 2, if the surgeon doesn't discuss the canthus or male eyelid anatomy or brow position, then they might just be thinking it's more of a cookie cutter approach where they can just do the same surgery for everybody instead of considering some of these subtle differences. And number 3, if they can't show you very many before and afters of men, then they might not have the relevant experience needed to be able to provide you with the outcome you're looking for with surgery. So here's our bonus tip. A very common thing I see is men coming in because they've got bags under their eyes and they're trying to remove those bags. That can involve removing some fat from under the eyes, or moving fat around, or adjusting some of the wrinkles under the eyes. There's lots of different techniques, but what is specifically important for men? Well, first you got to understand, why do you have a bag or a shadow underneath your eyes? You have to understand the anatomy. The way I like to explain it to people is, imagine if there were a speed bump in the road right next to a dip in the road. You want to have a flat road. You don't want to have that big transition up and then down. The speed bump in this example is fat that pooches forward from your eye socket above your cheekbone. So if you go and look in the mirror and you see some of that fat pooching forward, that's the speed bump in my analogy. The dip in the road is in your cheekbone. It kind of caves in right under that fat area because we lose fat in that area. If you don't think about those 2 things, the speed bump and the dip in the road, then you're not going to really understand how you're going to achieve a flat surface to the road. Some surgeons just want to cut out the fat and bring the speed bump down, even though there's still a dip there. And some surgeons just don't really understand the anatomy at all, and they just take skin. The goal is to flatten the road, to smooth things out so there's not as much of a shadow cast between that puffy fat and the cheekbone area down below it. Here are 3 key differences for lower eyelid bag surgery in men. Number 1, a lot of men have something called a negative cheek vector. So what the heck does that mean? Basically what that means is that your eyes are a little bit more prominent relative to your cheekbone. So if you think about it from the side, the eyes are more forward and in front, either level with the cheekbone or in front of the cheekbone. The reason that's important is that if a surgeon kind of pulls this corner of the eyelid up and you have a negative vector, it's going to beer belly the eyeball so that it's going to make it look like the eyelid is more pulled down. That is an important thing for your surgeon to understand. If they're going to do something called a canthopexy, they have to also be taking into account where your eyeball sits relative to your cheekbone, because the two are very related. Number 2, if a surgeon suggests something called fat grafting, that may be very appropriate. I do that in a lot of my male patients. Basically what fat grafting or fat transfer is it means you take fat from elsewhere in your body, usually the tummy or the inner thigh area, and you build up the cheekbone area where it's caved in, or in our analogy, you build up that dip in the road so it's more level in order to fill these areas. But the problem with this is that some surgeons will put too much fat in the cheek area and feminize that area by giving you a bigger cheek. Make sure you discuss this with your surgeon, because in my male patients, I'm putting very little in the cheek area and more under the eyes to blend that area without creating bigger cheeks. And number 3, wrinkles under the eyes, what we call smile lines, are very common. You're not trying to get rid of every single line under the eyes. The smile lines are created by very powerful muscles when you smile that bunch up this skin under here. Now, it's a totally reasonable thing to want to tighten some of the skin under the eyes. If you go to a surgeon where all they want to do is cut out the skin under the eyelids because they're trying to chase after all the wrinkles and the smile lines, well, that could be a red flag, because it means that really they don't understand what's going on and what the problem with that approach is. The problem with trying to cut out all the wrinkles under the eyes is that you can actually make the eyelids pull down, which can result in a very unusual appearance, something called lower eyelid retraction, kind of like a hound dog has their eyelids pulled down. It's not something you want, male or female, but especially in men. In my opinion, live with your smile lines a little bit and you'll be a lot happier. The bottom line is, male eyelid surgery requires a different approach than female eyelid surgery. If done right, it can make you look refreshed, sharp, and confident without changing your appearance in a significant way. And ideally, nobody will know you had anything done. If done incorrectly, like Kenny Rogers, for example, it can leave you with more of a feminized, unnatural appearance, and then you may have a lot of regrets. If you want to discuss male eyelid surgery with somebody who understands these differences, follow the link in the description to schedule a consultation. What questions do you have about male eyelid surgery? Drop them in the comments below. And if you found this video valuable, feel free to hit the subscribe button for more honest educational content on eyelid and facial surgery. I'm Dr. Eftekhari, and I'll see you in the next video.